Senator Smith.
Thank you, Chair Alexander, Ranking Member Murray. It's good to see all of you today, and thank you again to our panelists. So we need robust surveillance and occupational testing if we are going to safely reopen our economy and our schools, our nursing homes, and our group homes to make sure that they're not a conduit for infection. And we're seeing this. A good example of this is in New York State, where employees in nursing homes are required to get a COVID-19 test twice a week. So here's the problem if you're a worker. Who pays for that test? Is it my employer? Is it my private insurance, if I have insurance? Or do I have to pay for it out of my pocket? So I'm thinking about that low-wage worker working in childcare or food processing, or maybe as a security worker or a janitor. And the average cost of a test is somewhere in the neighborhood of $75 to $150, though there are reports of people being charged over $6,000 to be tested, assuming you can find a test. So this is my first question. Last week, federal agencies posted guidance on this question, and the guidance said that health plans are not required to cover the full costs of tests for surveillance or occupational reasons. And the federal testing plan, which talks about the value of surveillance testing and occupational testing, is silent on this. So let me ask you, Dr. Fauci, do you agree that we are going to be better able to contain the spread of COVID-19 and save lives if we have surveillance testing?
No doubt surveillance testing is going to be a very important part of the program to understand not only the current penetrance of the virus in society, but where it's going. Short answer to your question is it's going to be very important in our public health measure.
And would not also the price of these tests or the ability to pay for these tests be a pretty significant barrier to having that surveillance happen?
I think common sense tells you that if people cannot pay for it, they're not going to do it. And that's one of the reasons why we got to figure out how we can do it without having the stress of people who can't afford it to be part of that process.
Right. And of course, the worry, of course, is that this ability to pay for these surveillance tests, or this kind of surveillance testing, that could really tend to exacerbate underlying inequities, since a lot of frontline workers and essential workers who don't have the privilege of working from home are much more likely to be Black and brown and indigenous people, people of color. Isn't that right?
As in all cases, that people who are economically not able to engage in some of the things that benefit others, they always, in general, get a short end of the stick on that, and that's what we have to be concerned about.
Right, right. Well, colleagues, I think this is a really important place where we have the potential to work together to make sure that as we expand surveillance testing and occupational testing, as we look at our schools, our higher institutions of higher education coming back, that we have the ability to do this, and that the ability to pay for that test isn't a barrier. So I appreciate, Chair Alexander, you mentioned this at the beginning. Others of my colleagues have mentioned this, and I think this is a place where we could work together in a constructive way. I want to ask a question specifically related to vaccines, because there's been a lot of discussion about this, a lot of discussion about how we can make sure that people trust these vaccines, that they are safe, that they work, and that the long-term consequences, potential negative side effects, we understand those. So let me just ask, maybe I'll ask you again, Dr. Fauci, how do we trust a vaccine that has only had a short number of months potentially being tested in the human body?
There are a couple of ways to overcome that. First is that you have a large number of people in the trial. The trials that we're talking about now, we're going to have 30,000 people in the trial, and maybe even more in some of them. You can get a considerable amount of safety data, but then there's a process, after a vaccine maybe would show efficacy, to do further studies following licensure availability. I'll let Dr. Hahn maybe comment on that more, because that becomes something very much involved with the FDA's authority in making sure we do have safe vaccines. So, Steve?
Let me just, if I could maybe put a finer point on this question for you, Dr. Hahn. I mean, what if a manufacturer were to say that they could get a vaccine to market in January but only if they were released from liability. What's the FDA policy on that? How would you resolve that question?
Thank you, Senator. We would not get into the issue of liability for an individual sponsor. And what we would do, and that's why we released the guidance this morning, is we would ensure that our normal regulatory approach and our standards for safety and efficacy are met. So while we're all really
You would not
anxious to have-
release a manufacturer from liability.
that's not an FDA authority that we would
Okay.
use.
And how do you guard against
Senator
the
Smith,
possibility?
we're running a little late. Go ahead with your question, but the
This
witnesses
should be,
have to-
hopefully this will be an easy one. I mean, what I'm worried about is that there's some sort of October surprise and that there is a pressure put on the decision makers here to announce a vaccine in October of 2020. Dr. Hahn, can you just tell us how we can have transparency so that people can trust that that isn't happening?
Senator Smith, a very good question and really important and leads to the issue of public confidence. It's why we released our guidance today. We want to be clear about what the standards and the data that we'll need to make a decision and what factors go into those decisions. I want the American people to hear me when I say we will use the science and data from those trials, and we will ensure that our high levels of standards for safety and efficacy are met.
Thank you, Senator Smith.